Okay, Brenton, so we did our third hairline repair now. You initially had a surgery in another place overseas, and what was your experience there?
Not great, like, to be honest. I was sold a package deal, and I was after doing my research, and I wanted to make sure I had a natural hairline and all that, like, but at the end of the day I was brought in and the doctor didn't even do the procedure, it was other people, and my hair looked very pluggy and unnatural, and like, they didn't give me anything in regards to how to stop the hair loss, or, like, to prevent future hair loss. Like, so in the end I ended up with a very unnatural looking hairline.
So since you took the medication as well, the Proscar and the other, the Demerol and the Nizoral, do you think it's helped for your hair in general?
Oh, like 100%. Like, when I initially came here first, I thought I was going to need a second hair transplant, especially in these areas here. I just carried on receding. And you recommended to go on the Proscar, so after a year of Proscar it just all filled in, like, so I only really needed corrections at the front where I thought I was going to need a full hair transplant going further back.
So I just want to take a closer look here. I just looked it up a bit there. I just want to, so this is, we did the first session and the second session. We removed a lot of the grafts that were in the incorrect positions lower down, and then the hairline was too flat and too blunt here, and we put them back behind, and you can see that there's zero scarring just about. You can't even see anything, so that heals incredibly well. And we then continued to soften up the hairline and did some feathering. Yesterday we placed 265 grafts in the mainly single follicles, just to soften up the hairline, and basically this would probably be the last procedure in the hairline repair. So it's looking very natural now, and I think we'll our final assessment is at 10 months post-op, but all in all, do you think what do you think about going overseas to have hair transplants done?
I just wouldn't recommend it anymore. Like, you're basically told what, like, they'll tell you what you want to hear. Like, I genuinely was doing the research and I was asking all the questions, and it was pretty much lied to, and it's just not really worth it. Like, you get what you pay for, I guess, at the end of the day. Like, they're just out to sell you a package deal, and once they get their money, they don't care after that, really. Like.